I didn't get MBBS. Should I do BDS? If that's what you're thinking right now, then this video is just for you. In this video, I'm going to talk about some ultimate important points that you need to know and consider before joining BDS, especially in India. Because what you decide today can shape your entire future. Hi everyone, I'm Dr. Aishwarya. I'm a dental surgeon and a budding YouTuber. On this channel, I post videos about dentistry and a bits of my life which are totally honest, fun and unfiltered. If that's your vibe, then consider subscribing to my channel. So now let's get into the video. I want you to answer one question and I want you all to be really honest with your answers, because if you're not honest at this point, then at the end of the day, you will be suffering from that life decision that you make right now. And the question is, do you really want to serve people? Like really deal with patients, treat them and be with them both physically and even after treating that patient, be with them mentally? Do you really want to be that? I want you all to take a piece of paper and write it down right away, like now. Just pause this video and go sit in your table or wherever you're comfortable. Just take your paper and write down the answer for this question. Writing answer to this question is not so easy job, okay? It's not like telling yes or no instantly. This is the basic and the most important first step that you're going to take towards choosing your career. At this point, you can pause this video, close YouTube, take your paper, be with your paper, forget about everyone, forget about your parents, your relatives, your neighbors, your friends, everybody. It's just you and the piece of paper and your thoughts along with God's blessings. You're just going to sit and think, do you really want to do BDS or do you really want to do anything related to medical? Okay, do you really want to serve people? That's the question. Just pause this and write. I'm emphasizing on this point because I think it is one of the most underrated and not spoken by many people often. So I think this need to be addressed right away, because it's you at the end of the day really matters and your decision is ultimately important for you to live. For most of us, I'm telling, it's not us really who makes decision for our life. It's everybody else around. Like people, relatives, your neighbors, social media people, everybody. So just keep everything aside. Go and be with your paper. Just write it down if you really want to serve people or not. Think deeply before writing it. Okay? And come back and see the rest of the video. It can take a lot of time. It can take really a lot of time. You need to decide, you need to think all the pros and cons, you need to think about your health condition, you need to think about your family's financial status, everything before doing this. And I'll tell why all this is important after you choose your answer. First main thing is, do you really want to serve people? That's the question. Just write it down, pause this video and write this down, okay? Alright, now let's say you have answered it. The answer can fall into one of the three categories mostly. It can be no, I don't want to treat people, or yes, I want to serve people. Or it can also be yes, I want to serve people and be a doctor as well as I need to earn more money. I guess these are the major answers that most of you would be having right now. So this video from here is going to revolve around these three answers, okay? If you say I don't want to deal with patient and I'm not into that thing and I've thought about it, then I'm here to say that you have made your life decision and there is nothing, even not a single percent wrong about it. Just go for it, because this is not the end of the world. Medicine is not the end of the world, because, okay, you've decided for yourself. That's very good. And I wish you all the best for whatever path you choose and get all success and happiness that you deserve, okay? Then moving on to the next answer. And if you say I really want to be a doctor and since childhood I dreamt of becoming a doctor, then I can say that BDS is a potential option for you if you're not getting MBBS. I'll tell you why. Because dentistry is a respected white collar profession and there are many specialities within BDS and you can become a skilled and compassionate doctor. But I want to be a little real on the side, because it's not possible for everyone to shine immediately after your graduation. So that's a whole separate topic to discuss, and I'll make another video about it. And let's revolve around this basic important question first, okay? But if you say, yes, I want to become a doctor and I want to serve people and I need to support my family financially immediately after completing BDS, then my friend, this needs some caution. You need to reconsider your option of choosing BDS, because after BDS you will definitely end up with a job, maybe at a clinic or as a tutor, but with monthly salary between 5,000 to 15,000 per month. So if you're with a plan to financially support your family, and just think, after spending 5 years of your life, 5 years of hard work, you're just coming out with the intention to help your family, like finally I have completed my degree and I'm going to support my family, then you joining a clinic and you've just been given 5,000 or 10,000 in a month to run your family. Will that be enough for you? Like seriously, you will end up hating this degree that you've just did. BDS is not something that gives you money immediately after you complete your degree, because after BDS you need to improve your experiences and skills. You might need to join some clinics or hospitals, or do some fellowships, or do some additional internships or MDS, and that again needs to be discussed separately. Dentistry can become financially rewarding, but it takes a lot of time, skills, and lots of patience, to be really honest. So if your family urgently needs financial support, please explore other options too. Please don't join BDS just for the money. And to be really honest, there are lots and lots of degrees and career options out there to choose other than medical field. And I would say that we are just stuck in this NEET trap, and we are closing our eyes and not seeing any other things other than MBBS or BDS for that matter. And I also want to address one more thing. If you are someone who want to do this degree just for the sake of that doctor tag, then again I want to tell you this harsh fact that this doctor tag is not going to bring you any special benefits. It's not going to make you feel magical or something. You are just a doctor. That's what now currently the situation is. You are not the doctor anymore. You're just a doctor. So that is the three options. I've been really honest here. So if you want to do this degree, you just need to think again, okay? You just need to think again. I'm not scaring you or something. I'm not asking you to not take this degree. I'm just asking you to reconsider your thoughts. I don't want you all to complete your 5 years of BDS and sit and think, I shouldn't have done that. I hope this makes sense, okay? I'm not scaring you. I'm really telling this. This is the major thing that needs to be considered before joining BDS. If your family depends on you, then you definitely need to reconsider your option. BDS is not for you, I think, because immediately you won't get any money. Even if you have good hand skills, you might end up setting up a clinic. But it needs a lot of promotion. You need to again put in some money, and just think how many patients will come to your clinic. If one person comes to your clinic by chance, then you did treat the patient with all the knowledge that you have and with the best that you can. That patient will go and tell another patient that this clinic is very good, and that patient has to go and tell to another patient. Then it will happen slowly. I'm saying dentistry is financially super rewarding, but it takes a lot of time. You have to be patient. Do you have that patience? You have to ask yourself. Do you have that resilience? You need to ask yourself. Do you have that consistency? Again, you need to ask yourself. I'm telling you all this because I've been in your shoes, right? And I have given my NEET UG once, and at that time I had nobody to tell what BDS actually involved. So what are the potentials and what are the pros, what are the cons? I had nobody to tell that. So I'm here to tell you all my personal experience as a dental surgeon and what all I've gone through this 5 years journey, and at a private dental college, to be specific. I'll tell you everything. And in order to know all this, you need to consider subscribing to this channel, and all these further videos are going to be about it. If I had to tell something to the 17-year-old version of me, I will tell exactly this thing, because she was helpless, she was clueless, and she needed something like this. And I thought you might also need something like this, and that's why I'm here like a friend, or you're like a sister. And I guess this would have been helpful for you all. I will tell you for sure that once you've gained that momentum later in life in this dentistry field, you will definitely earn a lot. I can assure you that, okay? I've seen many dentists, my professors, they are just rocking it, and they are earning, not in the earning perspective. This they will come there, they will be the dentist, they will be the dentist, and they will be very inspiring to see, and dealing with people so chill and earning a lot. They are just living their dreams, right? They did a lot of hard work, they did a lot of studies, and here they are living their dream life. I've seen them also. So it's in our hand to decide what we need and choose wisely. If you want to know more about my BDS journey, then do consider subscribing to my channel and share it with your friends who are as confused as you are. Thank you for watching till the end, and I will see you in the next video. Bye.